I'm Grace David, and I'm doing a project with Jireh and Kathleen, and our project is about hypochondriasis, which is a somatoform disorder that characterizes the irrational fear of contracting an illness. And the therapy we're going to be showing in this film is cognitive therapy.
Good morning, America, and welcome to 10 Minutes. As you all know, my name is Dr. Jenny James, and today we're doing a special on hypochondriasis. We have brought in Dr. Harpers, who is a special on this subject, to help us enlighten us about this subject. Today we are at Jonathan Daniel's house, who is a hypochondriac, and will hopefully give us an insight on what it looks like to be a hypochondriac. Let's go ahead and knock on the door. So here with me today is Dr. Harper, who is a specialist on hypochondriasis. She's going to help us understand a little bit more about it. Dr. Harper, would you care to tell us more?
Sure. Hypochondriasis is considered a form of anxiety, also known as a somatoform disorder, that is a combination of depression and excessive compulsive thinking. And people who suffer from this disorder demand health perfectionism and will routinely check themselves in the mirror, checking for bumps or rashes and such things like that. They will also scour the internet for information concerning their illnesses. Although they fear having a disease, they will tend not to see a doctor because they're scared of the diagnosis, or they will visit many doctors, which is called doctor hopping, requesting for multiple tests. In many cases, hypochondriacs will do things to reduce their anxiety. But in reality, it will at first diminish it, but then in the long run, it will actually worsen it, which will increase their compulsive actions and increase their anxiety.
So, your mom actually sent us a video showing some signs of hypochondriasis. Do you think you're a hypochondriac?
No, I don't actually.
So, why we're actually here today is Jonathan's mom sent us an email saying that she thinks he has some signs of hypochondriasis. So we checked out the video, and it looks like he does. It started out after his severe illness, and ever since he's been really cautious about illnesses and really freaked out by that. So we're going to take a look.
This is his daily routine, and it's totally abnormal.
Alright, so I have, let's see, valsartan, I need that for my chest pains, high blood pressure, hydrocodone just in case, beta prostate for my prostate, triple omega, omega, that's great, that would be good for my health. Vitamin C, always need vitamin C, extra vitamin C, ginkgo biloba, that's mental, that would keep me mentally stable. I think this is Cortef, that'll be good. Let's see, Celebrex, that's crazy. No, I have Celebrex. Never mind, we have to pause it.
Mom is checking his mole,
What is this?
thinking it might be cancer.
Oh my gosh, what on earth?
Now he's going to the hospital thinking he's really sick.
Mom, I'm headed out. I'm gonna go to the emergency room. I think I might have some kind of infection or something, alright? I'll see you.
How you feeling, Johnny?
I'm not feeling so good. I think I might have measles or something really bad like that.
I think you might just have the flu or whatever.
Yeah, but I've been feeling really just tired. I have a fever. I don't feel good at all. I think I need to go to the doctors or something.
He just continues to clean over and over again. He just cleaned that table literally
this
30 minutes ago.
Salmonella on it. We could get poisoned.
So after seeing that video, do you still think you're not a hypochondriac?
No, I don't think I'm a hypochondriac at all. It's just I have to take these steps so I don't get sick again. It's not overreacting. I'm just making sure that I don't become sick ever again, because it would be horrible if I did.
So we've actually brought in a medical specialist on hypochondriasis from Harvard University, and we sent her your video, and she has diagnosed you. So we're going to bring her on the show to talk to you about that and try to convince you
Hi,
otherwise.
Jonathan. I'm Dr. Harper, and I'm glad that you actually took the initiative to come on the show. From what I've seen, the show sent me in the email from your mom. I've seen the videos, and it seems like you have symptoms of hypochondriasis. From the video, I've seen that you were constantly had a lot of pills, which shows that you're concerned about your health and every small detail you seem to be checking up on. You were constantly going to the doctor's office when it wasn't even necessary. You are constantly checking your reflection in the mirror to see if you have any new symptoms or anything, which is definitely not normal for people your age. Also, I saw you were sick, and it seems like you actually had symptoms of the flu, and you actually thought you had, I don't know, measles or something, which is totally not normal. And there's no need to worry, because if you engage in cognitive therapies, which is what I'm here for, I can help you get better.
But what exactly is cognitive therapy, and how would it help me if I seem to have hypochondria?
Well, we'll use cognitive therapy basically to modify the way you think about your illnesses and how you can change your thinking in order to get back to a normal state like a regular person. The first thing we'll do is to give you motivation to modify the way you think and your anxieties. Also, to distinguish between unproductive and productive behaviors when you develop these anxieties, and also just to modify your compulsive actions. Also, you're going to have to be able to learn how to accept that some illnesses are inevitable, and that seeking reassurance in the mirror or checking online every so often is not going to help your anxiety or even prevent an illness from coming on. And also, during cognitive therapy, I'll work with you to concentrate on your thoughts and give you relaxation tips. Also, you're going to have to talk to your family instead of seeking help from a doctor every so often. And you also need to see the main purpose of cognitive therapy is to see that the chief problem is your fear of contracting an illness. And even though it may cause inhibition in your life, or it may cause death, you... Okay, I'm done with that. Just cut that out.
So, why do you think I developed this disorder of hypochondria?
Well, it seems to me that after recovering from your past severe illness, that you're taking every precaution not to contract another severe illness. So you keep on taking medications to prevent it, or checking yourself in the mirror every so often, or you go into the doctor, and this is what is contributing to your anxiety.
So, you mean this extended fear that I've always had, and it contributes to the behaviors and this, the way I am and the mental state that I'm in. So, it really does seem like I do need therapy.
Yeah, that sounds like a really good idea, and that's basically what I'm here for, to help you get better, so we can schedule sessions over a few months.
Thank you for tuning into another successful episode of 10 Minutes, where we talked about hypochondriasis, what it is, and what it looks like in everyday life. To see what it looks like in everyday life, we asked Jonathan Daniels to be our guest and looked on at his daily routine. We learned that some of the symptoms, being very fearful of unrealistic diseases or cleaning excessively, etc. We also learned that it can be very taxing on family and friends. And Dr. Harper helped us realize that therapy can be a very helpful way of dealing with this. So we're going to look on at Jonathan Daniel later, so stay tuned for that, and we'll see if cognitive therapy works for him. Thank you so much for tuning in, and we hope you watch next time. Bye, everybody.